According to the United Nations, more young girls die from pregnancy and childbirth complications than any other cause. And for their babies, they're more likely to be born prematurely and undersized. The 5 countries with the highest teen pregnancy rates are Niger, Chad, Mozambique, Mali, and Liberia. Besides pregnancy, there is also the risk of sexually transmitted diseases, including HIV/AIDS. South Africa has the highest rate of HIV in the world. Nearly 1 in 5 the country's adult population has the virus. The government says it is confident that it's making significant progress in the fight against it, but stigma surrounding HIV still persists. CCTV's Rene Carme has insight.
Close to 300 to 400 people die of AIDS-related illnesses in South Africa every day. The South African Health Ministry hopes to expand its HIV/AIDS treatment program from 1.7 million people at present to 2.5 million by 2015. Government, HIV/AIDS activists and health practitioners agree that the country has come a long way since the first diagnosis and discovery of HIV/AIDS about 30 years ago. South Africa has moved from a period of so-called HIV/AIDS denialism to a more progressive approach when it comes to treatment, counseling and testing for the virus. Yet many who are infected are still too embarrassed to seek treatment, mainly because they fear being ostracized by friends and family.
My mother kicked me out of the house. I stayed with relatives. Relatives also, they were so scared of me. Also they didn't even want to touch anything or never mind being close to me. Dr. Cindy van Zyl and her colleagues at this non-governmental organization near Johannesburg are in the business of fighting discrimination and denial around this devastating disease. She's determined to educate and train as many nurses as possible to run HIV treatment programs, especially because South Africa does not have enough doctors to do so.
As recently as 2009, there was a waiting line for medication. So you'd wait for like 4 months to get treatment. So we had to move it away from being a doctor-centered program to being a nurse-run program. And through that, we've had many more people on treatment. I think so far in Soweto, we've trained over 1,000 nurses. Dr. Cindy also has a blog aimed at breaking down barriers such as stigma and ignorance. Rene Carme, CCTV, Johannesburg.